Yes, the answer is yes. Women actually should have their analgesia during labor. This is also endorsed in a statement by the Society for Maternal and Fetal Medicine. Mainly, the main reason for this is that positioning a catheter for pain relief during in early labor, ideally, prevents the risk of generating, let's say, aerosol generating procedures in the event, let's say, for example, of an emergency section. So on this basis, women should get their catheter position, ideally as early as possible. Of course, in the event of more severe COVID, care should be taken in order to exclude thrombocytopenia or coagulation issues, which have been reported, but this, of course, is not the case for most patients who have a mild or asymptomatic COVID.
There are many complications associated with COVID in pregnancy. In the mother, we discussed before, higher risk of mechanical ventilation, of ending up on ECMO and intensive care unit, and even dying. But for the baby as well, you mentioned fetal growth restriction. There's good evidence that preterm birth, especially if you have severe or critical COVID infection, is increased, maybe fetal death, some reports preeclampsia, etc. So yes, there are many reports that have been fascinated by them of COVID infection causing microthrombi in the placenta. And there are wonderful reports and now systematic reviews of those, and especially in mothers who are really sick. We do know that there is an inflammatory, cascade, and again, in fact, we should anticoagulate women who have severe COVID, and maybe even therapeutically anticoagulate women who have critical COVID or intubated in the ICU. So that happens, and I think actually going back to some of the earlier questions, I think the vaccination and even booster vaccination will protect the baby from any of these complications. The mother doesn't get very sick, doesn't get COVID at all. And so all of these complications will be prevented, FGR, IFD, microthrombi, etc. So really, really important vaccination. In terms of the vaccine, I haven't seen any reports of that causing microthrombi. The microthrombi come from COVID infection. Like you said beautifully, Christy, the vaccine, especially the mRNA, after they make antibodies, they dissolve, so they don't cause any problems in the baby or the placenta.